increase in cases. I'm just going to share my screen right now. So we're up to 178 cases now in our area. We have 5 hospitalized and none in the ICU at this point. We've had an increase in our outbreaks in our area. And we basically, in terms of our additions over the weekend, we added 27 cases, 16 in Cornwall and 11 as DNG. Some of these were related to some outbreaks, but again, sporadic cases, contacts, and so on. So we did add 27 over the weekend to really bring us again rolling average of increasing, because Cornwall is going up in terms of the numbers, but again our overall average in terms of the health unit is about 34.5 right now. Actually, that's actually at red, believe it or not. It's almost there. But again, we look at the trends, but again, it's not going in the right direction. Again, it's pushed up by those numbers. Those are, again, some are in some outbreaks there that are cluster cases. So we take that with a grain of salt, but still we are not steady. I mean, at one point we were talking between going below the orange line and going into yellow, but now clearly that's not the case. We're really now clearly in orange territory bordering on red. Now, in terms of the numbers overall and trends, that's going to be looked at over the week. But if you look at, for example, our numbers for over a week, we have gone up, regularly. You can see that here as we've gone up. So we need to keep an eye on that. Among those cases, we have had so far 15 VOCs in our area, and they're spread all over our area. There's not one particular area. Some of the commonalities are that contacts initially with this were in Ottawa or outside, traveled elsewhere, and so we have not at this point have the exact type of mutation told to us, but again, we do have increasing numbers, and if you know, provincially, the numbers have been going up in terms of the percentage that are positive. So we will keep an eye on that. And again, looking at those numbers, looking at where we are, looking with the VOCs that are definitely entrenched in our area, it's really a time to continue with those public health measures. I think it's extremely important. One of the things that we're also seeing, we've had an increase where we've had a bit of a decrease of our outbreaks. We've had an increase of our outbreaks right now. Again, most are still our residents and staff and not residents. Woodland Villa is still in outbreak. There's 50 out of the 50 positive, 1 is still active residents, and out of the 19 total positive staff, 3 are still active, and we're still continuing to support. The Palace is 2 active residents and resolved 3 of the original positive staff. Again, we're following them. The Glen Store, again, has no residents, 3 active staff. Place Rideau has 1 positive staff, a positive resident, no staff at that point. And then a couple of that we re-added the McConnell Manor with 1 positive resident and 5 staff positives. And Baldwin House, it was your group home, had 1 staff as well, positive, no residents. So that's, again, just a bit of an increase in the numbers, but sort of holding steady there. Again, a much decrease compared to what we had 4 weeks ago, but again, concerning, if you take that all into account, our hospitalizations have remained low, which is good news as well. In terms of our schools, we're now at, we have 19 separate cases in 16 schools. We still have that 1 outbreak at Glengarry District High School, but that was the only one. And so we continue to monitor that situation moving forward. And again, we need to be cautious about where we are with our numbers in our area. If you look at the Ottawa numbers, they're really going into red territory if they could persist that way. The decision of when and where a health unit changes will be made on Friday by the government. But again, let's see what happens with us. We're treading that thin line as well. Hopefully, again, those were because of cluster cases. Hopefully, we'll start seeing a downward trend moving forward to that. Now, a couple of things have gone on with vaccines. We have just as for the 4 vaccines now that have been approved in Canada, and the AstraZeneca vaccine we piloted in 3 health unit areas, pharmacies, and in about I've got 5 or 6 primary care areas across Ontario. Not in our area. The primary care partners will be in Hamilton, Toronto, Guelph, Peterborough, Simcoe, and Peel. And the pharmacy pilots will be Toronto, Kingston, and Windsor. Only for AstraZeneca. Nobody else is getting AstraZeneca. And at this point, we have no news on delivery of the Johnson Johnson & Johnson vaccine. So the other development that occurred is that we now have, directives as to the first dose being spread over a 16-week period, and that's going to be effective as of the 8th. And essentially, it'll be basically for everybody. We're able to spread it to 4 months, 16 weeks between the first and second dose. Again, this is to allow us to deliver more first doses to more people. I think that as we get more doses into April, we may be able to, once we've vaccinated everybody first dose, we may be able to speed up the second dose, but it's the maximum we can go to. The only groups that are going to be exempt from that 16-week separation, dose separation, are residents of long-term care retirement homes, elder care lodges, and assisted living facilities where there's greater risk, and remote and isolated First Nations currently in Operation Remote Immunity. So those are some of the new things that have gone on. Over the weekend, we had a meeting with the general, and we were told that our vaccine allocations would be ramped up significantly. We got preliminary numbers, and they at least gave us a month forward. We will be getting anywhere between 4,000 and 5,000 doses a week moving forward. Overall, the numbers are, again, I'm still waiting, but at least we have some ideas as to how we can plan moving forward. We're not going to be getting them in one shot. We're getting them batched in weeks. So we're now gearing for those numbers to rev up phase 1 to finalize those categories of individuals where we've got clinics now occurring all over. We've got mass clinics for healthcare workers working long-term care, retirement homes, and so on. And we're starting this week with 80-year-olds who have home care. And as of next week, there will be opportunity to register for clinics for 80 and over using the provincial system, which will be starting next week as part of phase 1 as well. So we have a whole choice of venues. We've isolated mostly six arenas around our area, plus other areas. Our hospitals will also be vaccinating certain groups, and so we've got plans that are now being more mobilized because we at least have an idea of what our vaccine flow is going to be for a month. We will be getting mostly Pfizer, but we'll be getting some Moderna as well. So which is good news. And so moving forward, there will be more plans and more clinics being put forward. Like I said, it was hard for us to start planning clinics in terms of booking individuals. We didn't know how many vaccines we had per week, and now we're presuming that except for the retirement homes that we're going to go and finish next week, we're not going to be giving that we're going to have that 4-month interval between doses. So that's going to, I think, in my mind, speed up things for first doses, and at least allow us to, and the fact that we know 4 weeks in advance, it'll allow us to really start planning a more longer term and be able to give more of a plans, month to month plan moving forward. Obviously, our goal is to go into phase 2, and phase 2, again, one of the things that we've got today, we've got a memo from the ministry, and just to repeat to everybody, really is that The Ontario phase 2 vaccination rollout is expected sometime in April, and that's exactly coincidental with the time that we believe we'll have done most of phase 1 and moving into phase 2. Again, it depends on vaccine availability. We are contemplating receiving more vaccine in April. That's what we've been seeing. We're also contemplating receiving different types of vaccines moving forward in April. So again, that to us is very good news. And so the phase 2, just to remind everybody, will be for adults between, so it's a high risk. The phase 2 will be more for high risk again. Adults age 60 to 79, beginning from 75 and over, and going down 5-year increments. People who live and work in high-risk congregate settings, shelters, those type of things. Individuals with high-risk chronic medical conditions, people who live in hotspots and with high death rates, and certain workers who cannot work from home. So, they changed the name from essential workers to who cannot work from homes, which again, which includes first responders, education workers, food processing industries, and so on. We have a list of those that will be going forward. So those represent bigger numbers, and those will represent bigger clinics. We have had, like I said, we tried this weekend. We had several clinics. We had in Cornwall and Castleman. In Cornwall, we went and we did our clinic in the actually on the ice surface in the Cornwall Civic Complex, and it went very well. It's just a matter of us looking at what types of venues we're going to have. We also have to look at their handicapped availabilities, handicap accessible, elderly accessibilities. Some of our clinics that we'll be doing for 80 plus, particularly the home care recipients, we're going to try to do either drive-through at some point as we move forward, or in other areas that we vet, which will be easier for access, single first floor access. And again, whenever we have a site, we always have a backup where we can have access to people coming in, and that includes the civic complex as well. There are certain entrances that we can use. Again, but we're trying to look at different venues, different age groups, different things. Mostly our big mass immunization clinics are going to be occurring really, towards phase 2 into phase 3, where it'll be open to the public, where we get more people coming in. Well, we have already done the elderly, the vulnerable ones, and so on. So again, that's our plan moving forward. Donc, bonjour tout le monde. On va commencer avec les chiffres ontariennes. Malheureusement, on a une augmentation des cas au niveau d'Ontario. Aujourd'hui, on a une augmentation de 1631 cas. Et on est à peu près à 310 000 cas en Ontario. Bien sûr, la plupart des cas sont encore autour de Toronto. Ottawa avait 57 cas. Et donc, ça va dans la mauvaise direction, malheureusement. Au niveau des cas dans notre région, nous avons des cas. Oh, excusez-moi, je vais juste retourner ici. On va aller là aux statistiques locales. OK, donc nous avons ajouté cette fin de semaine 27 cas dans notre région. En effet, nous avons ajouté 16 à Cornwall, 11 à SDNG. Remarque qu'à Cornwall, on avait des flambées et il y avait quelques cas, plusieurs cas dans un foyer. Donc, le contexte est un peu différent. Par contre, c'est 27 et comme vous voyez ici, au niveau de la moyenne mobile, on est bien sûr, on approche le rouge. Il y a à peu près une semaine et demie qu'on parlait de haut, est-ce qu'on pourrait aller à la jaune? Mais regardez, surtout à Cornwall, on a un trajet dans la rouge déjà. Et puis, nos chiffres aujourd'hui, au niveau de le Bureau de santé de l'Est Ontario, nous mettent à la limite d'orange. Parce que la limite supérieure d'orange est 39,9. Et vous voyez, Cornwall est beaucoup plus élevé. Par contre, ceci vraiment est un résultat à cause de plusieurs cas ensemble dans les mêmes foyers ou dans des flambées. Donc, espérons qu'on va avoir une diminution. En effet, le ministère va décider vendredi si on reste dans l'orange ou on change. Donc, espérons qu'on pourrait rester et pas augmenter. Il n'y a pas de question, à mon avis, qu'on va aller à jaune, soit qu'on reste à l'orange ou on augmente au rouge, mais je crois qu'on va être stable. on va voir. Les autres indicateurs au niveau d'hospitalisation dans nos régions sont stables. Le taux de positivité, le taux de reproduction est encore dans les limites d'orange. Par contre, nous avons jusqu'à date 15 variantes de mutation, VOC qu'on appelle en anglais, dans notre région, qui viennent on les voit dans toute la région du Bureau de l'Est Ontario, et on a plusieurs qui sont tracés au Ottawa ou quelqu'un qui a voyagé en dehors de cette région. Donc, ça, c'est une chose, pour nous, c'est un message important. Voilà, nous avons les mutations, les variantes dans notre région, et vous voyez que les chiffres vont en augmentant, qu'il n'y a pas de bonnes nouvelles. Donc, ceci, à mon avis, est très important pour qu'on puisse continuer vraiment, vraiment avec un respect étroit des précautions de santé publique, les mesures de distance physique, masques, etc., sont très, très importantes à ce moment-là parce que vous voyez, on est à la limite, nous. Ottawa, déjà, sont dans la rouge au niveau de ces chiffres, et si je pense que ça continue, les autres aussi vont être mis dans la rouge si ça continue d'un trajet en augmentant. Donc, au niveau, on voit ici qu'on a 8 flambées. Ça, c'est un autre chiffre qui a augmenté depuis quelques jours. Par contre, c'est beaucoup moins qu'on avait il y a à peu près un mois et demi, au mois de janvier. Au niveau des éclosions dans les maisons de longue durée, on a toujours Woodland Villa qui est en éclosion. Il reste un actif résident parmi les 50 qui étaient positifs et 3 employés actifs parmi les 19 qui étaient positifs. Bien sûr, on continue nos suivis et nos supports. Le Palace, il y a 2 cas positifs actifs des résidents et aucune des 3 employés qui étaient positifs initialement sont actifs actuellement. Au niveau de Glenstone Lodge, il n'y a pas de changement, il n'y a aucun résident. Place Rideau, il y a un résident qui est positif et on fait encore nos dépistages de routine et des protocoles de routine. McConnell, Manor, Treadwell a tombé dans une flambée le 5 mars avec un résident positif et 5 employés. Et Baldwin House avait un employé qui était positif. Et en effet, encore, on n'a pas beaucoup de résidents qui sont positifs, mais quand même, il faut faire attention. Toutes ces maisons-là ont été déjà vaccinées et on voit qu'il y a peu de résidents qui sont positifs à ce moment-là. Au niveau de nos écoles, nous avons ajouté 2 cas dans les écoles aujourd'hui, hier et aujourd'hui. Je veux dire le 6 et le 7 mars, soit samedi et dimanche. Et on a en total 19 cas actifs dans 16 écoles avec une flambée actuellement. Donc, encore, je veux juste souligner l'importance de suivre nos précautions de santé publique parce que vraiment, on a des bonnes nouvelles au niveau des vaccins, on a de mauvaises nouvelles au niveau des variantes qui sont dans notre région. Et en effet, partout en Ontario, le pourcentage des positifs en Ontario, c'est 35% de tous les cas positifs apparemment. On n'a pas encore les souches exactes au niveau des variants dans notre région. Donc, on tombe dans des bonnes nouvelles au niveau du vaccin. Il y a plusieurs changements qui ont été faits depuis quelques jours. La première était qu'on rajoute un 4e vaccin dans nos répertoires, si vous voulez. Encore, on n'a pas de nouvelles dans notre région pour AstraZeneca ni Johnson & Johnson. On sait que AstraZeneca il va avoir des projets pilotes dans 3 bureaux de santé, soit Toronto, Kingston et Windsor, au niveau de pharmacie. Et aussi, il va y avoir des projets pilotes au niveau des médecins des soins primaires, Hamilton, Toronto, Guelph, Peterborough, Simcoe, Muskoka et Peel. Donc, ça, c'est des bonnes nouvelles. L'autre chose qu'on voit, c'est qu'on a maintenant l'autorité d'avoir 16 semaines intervalle entre les 2 doses de n'importe quel vaccin. En effet, ceci est pour nous donner la chance de donner la première dose le plus vite possible, de ne pas attendre pour la deuxième dose, de ne pas réserver la deuxième dose, sauf pour les personnes qui demeurent dans les maisons de retraite ou des foyers de longue durée. Donc, ça, c'est les exceptions. Et les Autochtones en Nord aussi. Donc, on procède avec ça dès le 10 mars, donc mercredi prochain. L'autre chose qu'on a appris cette fin de semaine, c'est que le débit de vaccins va commencer à augmenter et nous aurons dorénavant les allocations hebdomadaires pour 4 semaines. Donc, on les a, eux, sont pas mal plus élevés, sont entre 4 et 5 000 doses par semaine, mais on a une garantie pour 4 semaines. Donc, on pourrait planifier. Avant, on n'était pas capable de vraiment planifier plus qu'une semaine avant parce qu'on ne savait pas qu'est-ce qu'on recevrait la semaine après. Donc, à ce moment-là, on aurait la chance. La plupart vont être Pfizer. En effet, il va y avoir que 2000 parmi ça, 2600, je pense, de Moderna, mais la plupart vont être de Pfizer. Donc, on est maintenant dans une position pour vraiment planifier pour le mois prochain. En effet, nous allons continuer à vacciner les phases 1, surtout les travailleurs de la santé. On va commencer aussi avec les personnes qui reçoivent les soins à longue durée à la maison. Et bien sûr, on va commencer avec les personnes qui sont plus que 80 ans la semaine prochaine à prendre des rendez-vous. Le système de réservation de rendez-vous va être mis en marche le 15 mars, la semaine prochaine. Donc, on va commencer avec les personnes de plus que 80 ans. Nous pensons que, selon ce qu'on voit, dans quelques semaines, on va avoir fini de vacciner toutes les personnes en phase 1. Et selon le ministère et selon mes calculations, si les vaccins commencent à augmenter un peu plus, c'est ça qu'on prévoit. On prévoit des millions en mois d'avril et ça ne compte pas AstraZeneca ni Johnson. Et à ce moment-là, on passerait en mois d'avril au niveau des autres, les phases 2 qu'on appelle. En effet, ça va être les personnes 60 à 79 ans, commençant avec les 75 ans et maintenant et 5 ans en moins en incrément. Les personnes qui demeurent dans les maisons de foyer, etc., qui ne sont pas les maisons de retraite, les personnes avec des maladies chroniques, et aussi les personnes qui ne pourront pas travailler à la maison, soit les premiers répondeurs, les éducateurs, les professeurs, enseignantes, etc., et les personnes qui travaillent dans l'industrie de alimentation, etc., processing industry. Donc, c'est à suivre. Donc, maintenant, nous avons plusieurs cliniques que nous avons mis en place. Nous avons des plans pour avoir 6 gros cliniques de masse dans notre région, mais on a des cliniques à travers aussi au niveau des, dépendamment, c'est qui va vacciner. Cette fin de semaine, nous avons fait des cliniques à Castleman et Cornwall dans l'aréna, pas sur la glace, mais il n'y a pas de glace, mais on a fait ça là pour vraiment voir. En effet, nous cherchons aussi des autres locaux autour qui sont facilement accessibles. Et bien sûr, à chaque fois qu'on choisit une place pour nos vaccins, c'est sûr et certain qu'on regarde l'accessibilité. Ça, c'est très important pour nous. Mais maintenant, on va être en position de vraiment avoir une planification pour le prochain mois pour dire, OK, on va avoir des cliniques là, des cliniques là. Encore, sont des cliniques qui sont restrictées aux personnes qui sont dans phase 1 ou phase 2. Mais phase 1 va être, comme je dis, on va être probablement fini d'ici fin de mars. Et on commence, comme je dis, la semaine prochaine avec les personnes 80 ans et plus. Cette semaine, on commence avec les personnes 80 ans et plus qui reçoivent les soins à la domicile parce que les personnes qui reçoivent les soins à la domicile sont dans phase 1 aussi. Donc, c'est ça. Donc, on a des bonnes nouvelles dans ce sens-là, mais de notre côté, on a des mauvaises nouvelles avec les chiffres. Donc, c'est qui va gagner? C'est une course. Donc, espérons qu'on va continuer avec les mesures de santé publique et on va continuer avec le vaccin, avec le débit qui va augmenter sûrement dans les prochaines 4 à 6 semaines. So I'm just I have a few questions here that I received from the media, if I can find them, and I will answer them, and then we'll go to the phones. I have a question here. What happens if someone doesn't answer the robocall? For contact tracing, we don't use a robocall. We need to speak to somebody because we need to get an idea of where that person contracted it and who the contacts are. The other question here is related to what happens if who don't answer private answers. We have programmed our phones to, for that reason, to say it's East Ontario Health Unit that's calling. A number of readers have raised concern over the accessibility of Ed Lumley Arena in Cornwall. Well, first of all, like I said, we are going to be doing multiple settings for multiple people. I personally visited the arena myself with Mayor Clement last week, and we were shown different entrances that can come in, that we can bring people in who are handicapped and so on. So we really need to remove all those things. And also some of our 80 plus clinics are going to be done in other areas that are easier to be accessible to. So that's top of mind. And wherever we will do immunization clinics, again, the arenas like that are going to be reserved for mass immunization clinics, where we've done a lot of the vulnerable and elderly. But even that, the staff was kind enough to show us really places where we would come in from the side and so on. So we'll have that clearly marked. And it's not only for Cornwall. We have six sites that will be doing mass immunization clinics, and every site that we look at, we always look at accessibility. That is very important to us when we do a site visit and we selection and we set a site. The other thing I want to make clear to people is that the reason we're doing it in arenas, usually we do it we have done mass immunization clinics in high schools or big community centers and so on. The problem now is that as we ramp up to do mass immunization clinics where we have like 15 or 20 different state vaccinators vaccinating at the same time, we are quite limited now, because if we were to do we use the same gyms, for example, that we used for H1N1 in our previous clinics, and we have to distance each table by 6 feet and distance people waiting, after the vaccine by 6 feet. We're much more limited to the number of vaccinators and people that we can handle. So this is why we need big spaces. We need arenas. We need big halls that can accommodate that. In Hawkesbury, we're doing it at the big track and field area. We need big space so we can put in 15, 20 vaccinators at once. And also respecting the 6 foot distancing, but also at the same time making sure that this weekend I was there, the chairs were 6 feet apart, people waiting for vaccine after they got the vaccine, because you have to wait 15 minutes for observation. Whereas when we were doing them typically we'd have them in theater style. You have rows and rows of chairs. You can have multiple people waiting there. So that's the reason we need big places, because otherwise we wouldn't be able to put through as many people as we want. And our goal is to put as many people through the vaccine process on a daily basis as we can, and this in multiple settings. So that's why we wanted a big area, and we're not the only ones. All my colleagues across Ontario are using arenas and big venues for that reason. Je vais le faire en français aussi parce que c'est très important. On a des personnes qui me demandent accessibilité au niveau des arénas, etc. Parce qu'on a fait cette fin de semaine une clinique à l'aréna, au Ed Lumley, au complexe civique à Cornwall. Bien sûr, il y a beaucoup de places qui ont d'autres sont plus faciles à être accessibles, mais j'ai visité personnellement avec le maire Clément la semaine passée, et on a constaté qu'il y avait on pourrait avoir des entrées spécifiquement pour les personnes avec les problèmes mobiles. En effet, nous allons aussi avoir des cliniques de volants aussi qui vont aider. Donc, on va voir toutes sortes de choses pour ça. Mais je vais expliquer pourquoi nous avons choisi une aréna ou des grandes places comme à Hawkesbury. Ça va être fait dans dans le grand gymnase où on a le track and field, parce qu'on a besoin d'espace, beaucoup plus d'espace qu'avant. Avec H1N1, avec clinique d'influenza, on pourrait mettre 15-20 vaccinateurs comme proches d'un autre, dans un gymnase, par exemple, ou dans une salle de conférence. Mais malheureusement, avec le fait que nous avons besoin d'avoir 6 pieds de distance de chaque table de vaccination, de station de vaccination, et 6 pieds distance de chaque chaise sur laquelle quelqu'un qui a reçu son vaccin va s'asseoir pour observation, nous limite si on fait ça dans un gymnase ou dans une petite place. Donc, c'est pour ça qu'on a besoin des arénas. Comme ça, on pourrait mettre 15, 20 tables séparées, 6 pieds de distance, avec assez de place pour mettre des sièges 6 pieds de distance pour accommoder le plus de monde possible. Et on fait la même chose à travers de notre région. Et mes collègues font la même chose à travers d'Ontario aussi. I'm ready for some questions, Jenna.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul. My first question, you mentioned you said there was 15 variants of concern. Yeah. A couple of weeks ago, you said that you were looking at breaking those stats out on the website, like locations or at least numbers for tracking. Do you know approximately where those variants of concern
are? They're all over our area. That's why we didn't put them there. So they're not just tracked to one. We will eventually put them on our website, but I was waiting. What I'm waiting for, Philip, is final identification so I could put them on. If you go to the ministry website, we have none at this point.
Okay. And second question, and this is really in reaction by our readers from the announcement of the 6 mass sites, and you've touched on this already about the size and that, but given the retirement levels that are in South Dundas and also low-income populations where transportation to even Winchester is a challenge, or Cornwall, are there any sites being considered for South Dundas? Outdoor, 24-hour. Can you maybe expand on that a little bit?
We are looking at those things right now. Now that we have a better timeline on numbers and so on, we're always looking at that. We will. First things, in terms of transportation, we're working with the municipalities to ensure that they can provide transportation, just like I did with H1N1. And we're also looking at opportunities for us to go to people or to set up people that are closer to them. So yes, these are the mass immunization clinics that we're trying to do for, a lot of people, not the age, when we start doing those big mass clinics. But certainly we do want to take into account accessibility. That's why we're working with our accessibility in terms of transportation. To be able to have clinics or opportunities for transportation and so on, so that won't be a barrier.
Once weather is better, will you be doing outdoor clinics?
Outdoor drive-thrus, actually, yes.
Okay. Okay. All right, thank you.
No problem.
Next question, James Morgan, The Review. Please go ahead.
Sure. My question is, have you heard of any report of customers and the owner being fined at a restaurant in Hawkesbury for violation of public health regulations?
I know that I'm not sure about Hawkesbury, but I know that we had a spree of inspectors that issued some tickets. I know that they issued some in Cornwall. I'm not sure if they issued any in Hawkesbury. I don't know about that.
Yeah, I was just wondering.
It wouldn't have been us. It would have been part of the that sort of rotating ministry team.
The provincial inspectors.
Yeah.
Okay. Thank you.
Welcome.
Next question comes from Natasha Wood, Nation Valley News. Please go ahead.
Hi, Dr. Paul. I was going on the on the Eastern Ontario Health Unit website, and it says there are 8 outbreaks, but I can only count 6. And I was just wondering if you can confirm all of the locations of the outbreaks.
Okay. 1, 2, 3, 4, 5, 6. Yes, because it includes a school and a daycare outbreak.
Okay, thank you so much.
You're welcome.
Next question, Nelson Zandbergen, Nation Valley News. Please go ahead.
Hi, Doctor.
Hi.
My question as well was about the robocalls. You mentioned it's not used in contact tracing, but I think that question pertained to the use of robocalls in vaccinations. Robocalls have a little bit of a bad rep as far as their use because of scammers and things like that. How has it been working out, reaching out to the 80-year-olds in the community? What percentage are getting back to you of those that have been called so far using the robocalls?
We just did it. We just rolled it out now over the weekend, so I don't have the answers. That's not our choice. We just wanted to. We had a bit of extra vaccine, and we wanted to speed it up. That's why we did it that way. Ordinarily, we would call them.
Okay, so ordinarily you will call them.
Yeah. This was exceptional. That's why we sent a media release over the weekend saying it's us. Don't worry.
Okay. People have been asking about folks with comorbidities. I think you answered the question, but in April, that's when people with complicating diseases and so forth will be able to get the vaccine.
Yeah. And there's some certain that have more. There's certain conditions. For example, immunodeficiencies, people with immunocompromising medications that are actually first. So we have a protocol for those as well. Yeah, but it's in April. That's what
like diabetes and dialysis.
Yeah, those. But those will be later.
Okay.
The ones that are doing are people who have transplant recipients, those type of things. That'll be more priority. But I do suspect that those, because initially what we had when we had phase 2, we had like all of the different phases, like the priority 1, priority 2, priority 3. But I believe that it'll be rapid. It'll be sort of all of those things together at some point because we'll have enough vaccine.
And I'm sorry, everyone wants to know when their group is covered, or getting vaccinated. But transit workers and bus drivers, well, what phase are they in?
They are. I can tell you right now, they would be in the essential workers, front facing. We call them front facing. They can't work at home. They're there. So it's first responders. It's don't quote me on that. I had it somewhere here. Hold on. But we're starting with those, but those would be in the second phase as well.
So April as well.
Yeah, April as well. Yeah, that's it. It's we're just waiting. We had a sort of preliminary. Here we go. I'll tell you in a second where they would be. Yeah, they're all considered phase 2. Some of them sort of more priority than others, but they're all considered phase 2. Talking, first responders, frontline, elementary, childcare, food manufacturing, agriculture. Then you'd go to critical retail, transportation, all kind of sort of considered, the same. But we have them as first, second, and third priority within that. So
okay,
yeah, it's phase 2.
Thank you, Doctor.
No problem.
Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux.
Bill Kingston, Cornwall News Watch. Can you hear me okay, Dr. Paul?
Yeah, Bill, go ahead.
Yes, based on your VOCs going from the last report being 4 and now 15, given your investigation and what you've seen about all these cases, are you concerned at all that you might have a St. John's, Newfoundland scenario with an explosive reaction?
I hope not. So far, knock on wood, we've been able to isolate and contain them, Bill, but that's my worry, of course.
Right. Have you been seeing whether there's any similarities? I know in Newfoundland, the VOC, the UK VOC, was predominantly spread by asymptomatic younger people that set it off. Is that what you're seeing here?
We have not. Yes, actually, asymptomatic or very mild contact, like not really, sort of a very small lapse of mask wearing, for example. But we haven't yet identified which one it was. All we know is that they're VOCs. We haven't had the mutation, the genetic sequencing yet.
Right. Okay, perfect. Thank you.
No problem.
D'autres questions par téléphone? Other questions by phone? We have one more from the chat box, Dr. Paul. Denis Babin, Radio-Canada, c'est à vous.
Oui, bonjour, Dr. Oumietis.
Bonjour, Denis.
simplement répondre, c'est une question à laquelle vous avez répondu en anglais en lien avec vos plans pour faciliter le transport de certains groupes qui demeurent dans des secteurs plus isolés de la région.
Oui, oui, merci Denis. En effet, nous avons choisi 6 locales pour l'élimination de beaucoup de gens, Mass Immunization Clinics, mais nous sommes conscients aussi qu'on a besoin. Premièrement, on va travailler avec nos partenaires municipaux pour arranger le transport pour les personnes qui ne pourront pas aller avoir le transport. Et nous allons faire nos mieux pour identifier les places où on devrait aller faire les petites cliniques pour vraiment faciliter l'accessibilité. Et aussi pour les personnes qui sont immobiles complètement, disons qui sont, ils ne peuvent pas, parce qu'à cause de raisons médicales, etc., qui restent à la maison. Pour ça aussi, nous allons les visiter chez eux. On va aussi avoir des cliniques au volant. Donc, à ce moment-là, une personne pourrait aller dans l'auto et ne pas sortir. Donc, il y a 2 choses. Une au niveau de transportation, et aussi au niveau de les personnes qui ne sont pas mobiles. Donc oui, on a fait la même chose avec H1N1 et on est très conscient qu'on ne veut pas oublier personne.
Encore merci.
Pas de problème.
That is all for today, Dr. Paul.
Thank you very much. Merci tout le monde.